Anyone who deals with chronic joint pain knows exactly what it feels like. You wake up, try to move your knee or your wrist, and it feels like rusted metal grinding on metal. The stiffness fights you every inch of the way. The easiest way to get through the day is to reach for over-the-counter painkillers, specifically NSAIDs like ibuprofen. They lower the inflammation and mask the ache. But relying on them as a daily, long-term crutch comes with a hefty physical cost. Consistent, heavy use of NSAIDs starts to wear down your body's systems. Over time, that daily pill increases your risk of developing gastrointestinal ulcers, bleeding issues, and even cardiovascular complications. Because of those compounding risks, many people dealing with chronic flare-ups eventually pivot toward holistic, low-risk alternatives like homeopathy to manage their daily discomfort. But going the alternative route requires accepting a very specific compromise. Take a look at this quadrant chart, which maps out your pain management options by comparing the risk of side effects against the scientific certainty of the outcome. Up here in the top right, you have conventional medicine, things like daily NSAIDs and joint surgery. They offer high clinical efficacy for managing pain, but they bring a high risk of side effects and recovery complications. Down in the bottom left, you have homeopathy. It sits in a completely different category. Extremely low risk of bodily harm, but with low scientific certainty and a lack of rigorous clinical trials backing its effectiveness. Operating in this bottom left corner means you have to completely abandon the traditional medical approach to fixing pain. To find relief with homeopathy, you have to stop looking for a pill to treat a broad disease label like arthritis and start hyper-focusing on the exact physical sensations happening in your specific body. Before we look at specific remedies, we have to establish the absolute limits of homeopathy. These highly diluted botanical profiles cannot repair torn tissue, and they cannot mend a broken bone. If you experience new, severe joint pain, trying to bypass a proper clinical diagnosis, like getting an X-ray or an MRI, is incredibly dangerous. Using alternative pain management to simply numb an undiagnosed structural injury will allow you to keep walking on a damaged joint. Doing that can permanently degrade the cartilage and the surrounding ligaments. There are specific red flags that immediately disqualify you from starting with homeopathy. If you suddenly cannot bear weight on your leg, or if you hear audible crunching and popping sounds deep in your knee, you need immediate medical imaging. Those symptoms point to distinct structural failures, things like a torn meniscus, a ruptured ACL, or a dislocated kneecap. These conditions require conventional medical intervention, and often surgery, to physically put the pieces back together. Securing a definitive clinical diagnosis from a physician is a non-negotiable first step. You must confirm that your joints are structurally intact before you start experimenting with alternative symptomatic pain management. Once you know you are dealing with chronic inflammation rather than a torn ligament, you have to navigate the homeopathic pharmacopoeia. It is overwhelming. Look at a shelf and you'll see over a dozen different remedies, all vaguely labeled for joint pain. Standard medicine gives you one pill for arthritis. Homeopathy requires you to match the medicine to the specific triggers that make your arthritis worse. This flowchart maps out the first diagnostic question you have to ask yourself. How does motion affect the pain? If your stiffness and pain actively improve as you move around, you follow the branch to a remedy called Rhus toxichondrin, or Rhus tox. The Rhus tox profile is highly specific. Your joints feel like those rusty hinges we talked about earlier. The pain is at its absolute worst first thing in the morning or during cold, damp weather. But as you force yourself to walk and your body warms up, the joint slowly loosens and feels better. Conversely, if your pain gets worse the second you try to move, you follow the other branch. That leads you to Bryonia alba. A Bryonia profile looks completely different. The pain is sharp and stabbing. Any motion at all aggravates the swelling. To get relief, your body demands strict immobility and heavy, firm pressure applied directly to the joint. If you buy the wrong bottle, if you take Rhus tox but your pain actually worsens with movement, the treatment will fail completely. The medicine only works if your physical movement patterns are an exact match to the remedy's profile. But motion isn't the only trigger. Sometimes joint pain is dictated by historical trauma or by strange patterns moving through the body. This brings us to the next branch of our diagnostic tree. Was this pain caused by blunt trauma or sudden overexertion? If the answer is yes, that points to Arnica montana. This remedy is optimized for joints that feel bruised, beaten, and extremely sore to the touch. You use this to accelerate recovery in a joint you recently overworked, rather than for chronic, weather-dependent stiffness. Then we have a highly specialized branch. Does the pain travel upward? That path leads directly to Ledum palestre. The Ledum profile targets gout-style inflammation. The joints become terribly swollen and make cracking sounds. Crucially, the pain starts low, in the toes or ankles, and visibly travels up the leg into the knees and hips. Ledum also has a very counterintuitive physical trigger. Despite the joint feeling hot and inflamed, the pain must be actively relieved by applying freezing cold compresses. The secret to homeopathic success isn't hunting for the strongest dose. It's having the discipline to map your exact physical idiosyncrasies, like whether you crave a cold pack or a heating pad, or which direction the pain travels, to a very specific botanical profile. Once you've successfully matched your symptoms to a remedy, you have to navigate the dosing. You'll generally find homeopathic potencies marked as 6X, 6C, or 30C. Standard medicine trains us to swallow a pill every 4 hours, no matter what. Homeopathy operates on a strict test and wait protocol. To do this correctly, you take exactly 1 dose of your selected dilution, and then you stop. If you notice any improvement in your stiffness, you let the medicine work. You do not take another pellet until the progress clearly stalls. On the flip side, if you take a dose and see absolutely zero response within a reasonable window, you halt the dosage entirely. Taking more won't force it to work. It simply means you picked the wrong remedy and need to reevaluate your symptom match. The primary advantage of using these highly diluted substances is safety. They do not interact with your other medications, and they will not damage your stomach lining. But the trade-off for that supreme safety is effort. You have to take on the mental burden of managing a trial-and-error methodology, constantly checking your body's response, rather than relying on a passive, guaranteed pharmaceutical fix. Ultimately, homeopathy is an adjunctive pain management tool to help you get through flare-ups. It is a way to manage symptoms, not a structural cure. You accept a lack of rigorous scientific trials. In exchange, you get a holistic layer of relief that will never tax your liver or kidneys. This checklist lays out the final criteria to help you decide if this approach makes sense for your daily life. If you are an alternative seeker who prefers holistic optimization, this fits perfectly. You're dealing with chronic inflammatory pain, and a doctor has confirmed you don't have any torn ligaments. Most importantly, you actually have the patience to track hyper-specific triggers, like whether a cold draft makes your knee throb. But if you are a skeptical pragmatist, you should bypass the homeopathic aisle. If you expect a pill to definitively override a physical ailment within 30 minutes, regardless of your behavior or your environment, this specific methodology will frustrate you. If you experience acute trauma, severe swelling, or a sudden loss of mobility, your first stop is a physician's office, not a supplement store. Treating joint pain effectively means knowing your own limits. It requires aligning your chosen remedy with the reality of your structural health and being honest about your personal threshold for patience, observation, and trial and error.